engaged with community and really engaged with community quite a bit in the first half of the year, where we hosted a number of webinars and had such a positive response from community to continue the dialogue that we decided to do just that. As some of you may know, I am very passionate about Alzheimer's disease. My father was diagnosed with dementia with Lewy bodies, and I served as a out-of-state caregiver. But my brother that lived in Rochester, New York with him was the primary caregiver, and can certainly appreciate some of the challenges faced both by the person living with Alzheimer's as well as the caregiver. And so it just really warms my heart to be able to be a part of this webinar series while we're engaging community and really trying to identify and discuss issues that are important to them. Next slide, Nick. I want to bring to just introduce our team, Links to Equity team. If you have any questions about the webinar series or if you need additional information, please feel free to reach out to either myself, Nick Francis. She's our program coordinator who has done an amazing amount of work to pull us here together this evening. And Nick, if you wouldn't mind sharing your email address in the chat, that'd be great if anyone has any questions. Also, our newest member of our team is Catherine Boxell. She is our project director on this project and has been providing leadership to the entire team as we engage at a community level. And then Gina Haynes Sanders has been a part of this webinar series as well as the first webinar series. Just an amazing grassroots patient advocate and really supported us at a significant level, both during the first part of the year and then as we continue to grow and evolve into the second phase of this project. So Nick, can we go to the next slide, please? So before we jump in and introduce our community leaders, who I'm excited about you all meeting, just wanted to give you a sense of how today's discussion will look. Obviously, I'll go through the welcome and introductions. We're honored to have Erin Gillespie. She was a major contributor to the webinar series at the first part of the year, and she was such a great communicator and engager and friend of the project that we invited her back to kick us off on our first webinar series. So Erin's going to talk a little bit about the impact of Alzheimer's disease and related dementias on our communities. So we're really looking forward to that. We'll then move into a Q&A session for Erin. If you all have any questions as Erin goes through her presentation, please jot them down and we'll go through that Q&A. We'll also have a broader community discussion once Erin completes her presentation and her Q&A. We thought that it'd be, we'd change our format a bit. And rather than having 2 to 3 speakers, we thought it would be a great idea to have one speaker really delve into the topics and leave the remaining 20 to 30 minutes of the discussion open for Q&A. The last go round, we didn't always have a lot of time to answer all of your questions that you submitted earlier in the process. And then B, we also wanted this to be a safe place if you had more support type questions that you wanted to raise, recognizing we have our community leaders on the call as well as our experts. And then the Links to Equity team, we thought would be a great resource to just have a dialogue and talk about issues that are important to you so that we can better understand what that looks like at a community level, but also serve as a resource to community. And then as we did last year, we'll have our survey. Your responses to these surveys are very important to us because they help us improve the session. It helps us, which is really how we got here today. We had such an overwhelming response of individuals indicating they wanted more on this topic. They wanted us to continue the dialogue. So that's why we're here. And it's really based upon your feedback that you shared with us in your surveys and your follow-up with us after the webinar series. And then I'll just close out the webinar series and talk a little bit about our next webinar that we're going to have in January. Next slide, please. So I want to very quickly just run through our advisory board members to acknowledge them. And then I have two, because we're growing with our community advisory board members. We're going to have just two of them introduce themselves, but I certainly want to acknowledge all of them. They help really support this series. They give us amazing insight. They share awareness with their various community partners, but also through their networks. We're just grateful for them. The first is Reverend James Thurman. He's a pastor at Zion Baptist Church in Kentucky. We have Cheryl Tier. She's a president of the Links in Washington, D.C. We have Reverend Joseph Owens. He's on our call. He's actually going to do an introduction once I get through the list of members. He's the pastor of Shiloh Baptist Church, and he'll probably provide a little bit of clarity for you on that. And then we also have Jacqueline Lee. She's the president of the Links in Kentucky, the Kentucky chapter. We have our newest advisory board member, Rosalind Daniels Walker. She's going to give an introduction and share a little bit about herself and the work that she's doing in Maryland. We have Cheryl Petty Garnett. She's the recording secretary for the Links in Maryland. Shamika Bacon, she's in Tennessee. And she's going to share, she has also an extraordinary background, such a community leader. We're excited to have Shamika be a part of this, our community advisory board members. Eugene Banks, he is in Greensboro, North Carolina. He really focuses on community supported projects and leverages his background in the basketball space, doing a lot of work in the sports space and leveraging that to educate at a community level. And then we have Vila McLean Thomas. She's in Kentucky and Atlanta, and she's been a great partner as well in engaging her community partners. So with that, I'll start off with Rosalind, and then I'll go to Pastor Owens. Rosalind, can you please give come to bring your face to the screen, and oh, you're already there, and share with us a bit about your background and the work that you're doing with the Links in Maryland.
I certainly will. And first of all, good evening to everyone. I am just delighted to be here. I am Rosalind Daniel Noes Walker, and I am currently the president of the Mount Rose, Maryland chapter of the Links Incorporated. Tell you a little bit about that in a second. My professional background, though, has been the program manager and then later senior manager for the federal government's division of Verizon's Verizon Incorporated, Verizon Telecom. So I did that for many years, and then I transitioned out. I retired in 2016, and now I'm full-time in the community doing full-time stuff. So as part of the Links Incorporated, if you may know, you may or may not know about the Links, we're 17,000 plus women across the United States in 48 states, and then also in the United Kingdom and in the Bahamas. We are broken down into groups of service, including services to youth, national trends, international trends, the arts, and health and human services. I happen to serve as the co-chair of the Health and Human Services Division for the Eastern area, which includes it includes 8 states. So we do a lot of work in the community related to African American issues and concerns. We're very interested in dementia. Our chapter has actually sponsored a dementia workshop 2 years ago, which was very effective, and we learned a lot about that. We also know there are a lot of other chronic illnesses in our community that we focus on. Last year, nope, it wasn't last year, it was 2023. I guess that was last year. We sponsored the remote area medical clinic in our community, and we served in a day and a half over 400 people who were delivered free medical, dental, and also vision services at no cost to the community. So we're very engaged in the issues that surround our community. And of course, Alzheimer's is one of them, and we're really interested in knowing more about that and how we can share information, services, and resources with our community.
Thank you so much, Ross, and I really appreciate that background. You've been an amazing partner thus far, and we are so excited for the partnership with you and your chapter at the Links. Pastor Owens, can you please give us an just a little bit of a background on you and the work that you're doing?
Thank you, Dean. Thank you so much for the call and the privilege to serve. I'm actually part of the Kentucky delegation here in Kentucky, particularly the Lexington area, serving along with the Reverend Dr. James Thurman, who's having a little trouble getting on tonight, but I wanted to be sure that you knew about him too, a local pastor as well as commander for the NEPVETS here in our state. I'm recently retired, hallelujah, after 43 years of pastoral ministry, but still actively engaged in the community. Actually, I'm pastor emeritus now at Shiloh. As a part of the Kentucky delegation, I've had the privilege of serving and keeping connected the Black First community across denominational lines with the many churches and faith organizations here. 25 years or more of community organizing, particularly around community justice and health issues are definitely a part of that community justice. So I'm excited to be a part of this delegation and particularly this advisory board to be sure that all people and every people that need it have the opportunity to have access to that which will help them to be more healthy. Thank you, Dina.
Thank you, Pastor Owens. We really appreciate you. Okay, so we're going to go to the next slide. We just always like to acknowledge our community leaders because they're really the reason why we're here. And we are so appreciative of them and them opening up their community and their hearts to the work that we're doing. So we have much gratitude to them. So I'm going to jump into our next speaker. We mentioned her at the top of the meeting, Erin Gillespie. She's the director of programs for the Alzheimer's Association in Greater Kentucky and Southern Indiana. She was born and raised in Richmond, Kentucky, and currently resides in Lexington. Erin received her bachelor's and master's degree at Eastern Kentucky University while focusing on public and nonprofit. While working on her master's degree, Erin was a caregiver for her grandmother, who was diagnosed with Alzheimer's disease. This experience and her education led her to a career in public service. As the director of programs, Erin leads DEI initiatives, drives efforts in community outreach, disease education, and support. As I mentioned earlier, Erin provided us with such great information during our first webinar series, and we're so excited that she accepted our invitation to kick off this webinar series. With that, Erin, I'll give the floor to you.
All right. Well, thank you again. I'm so honored to be here again. Last year, it was just an amazing webinar series, and I'm thankful for each one of you all to invite me back and also to listen to our message and the importance it is to know about Alzheimer's and dementia in our communities. So give me just a second and I will share my screen. All right. Can everyone see that?
Mm-hmm.
Perfect. So as it was introduced that I am the director of programs for the Alzheimer's Association, and some people are like, what does programs mean? So really what that means is I am the care and support pillar, me and my team of the Alzheimer's Association. It was also talked about that I was a caregiver for my grandmother. My grandfather passed away. We knew that she had some memory issues. We didn't know to the extent, and oftentimes that happens when the caregiver, the spouse, is taking care of of the loved one. Sometimes you mask some of those things. Sometimes you kind of hide some of those things, and sometimes intentionally, and sometimes not. We knew that we weren't ready for my grandmother to transition to a facility or another care option. So I was working at a bank. I'd already got my bachelor's degree, and I was like, me and my grandmother were incredibly close. She taught me how to paint. Most kids wanted to go to their friend's house on the weekends. I wanted to go to my mom's and papa's. So while that journey was very difficult, I wouldn't change it, but it also taught me a lot. So professionally and personally, this is a mission of mine, not only to get the word out, to break some of those stigmas, but also to start talking about it and understanding that there is a difference between memory loss and aging and then this disease. So again, throughout this presentation, write down your questions, put them in the chat. I'm happy to have a discussion. I want this to be a discussion because it's incredibly important that you understand what's going on, but also that you're open to talk about it. So every year, let's see. Every year, the Alzheimer's Association comes out with what we call a facts and figures report. And so what this is the information and data that we collect. The figures report provides an in-depth look at the latest statistics of Alzheimer's disease, prevalence, mortality, caregiving cost, and cost of care. So this last year, if you are interested, there is a video. I did not want to muddy the waters and try to do a video because sometimes it works and sometimes it doesn't. But really, this infographic gives you all the information from that video. But it is over 100 pages long. So if you want to nerd out and read all of it, please feel free. And that is at alz.org/facts. But some of the things that really stick out to me is the 1 in 3 seniors die of Alzheimer's or other dementias. But one thing, I started here in 2021, so it's kind of, we're trying on the back end of COVID. Everybody's virtual. And so my grandmother had Alzheimer's, was diagnosed over 10 years ago. This space has changed incredibly. And so when I first started, our facts and figures report really focused on DEI and how this is affecting different communities and why that is. But then the facts and figures report said a little over 6 million. That wasn't just 3 years ago. And now we're almost at 7 million. So me personally, that really sticks out to me. Also, it kills more people than breast cancer and prostate cancer combined. So you can see here the impact that it's having on our community. And just this year, there's always a special report, like I had said, but this year it really focused on caregivers, the need for caregivers, the stress of caregivers, not only personal caregivers, but also in our health systems. What does that look like? What does care navigation look like? Because unfortunately, that hasn't really been talked about a lot, and there's not a lot of options, and we are getting there eventually. And so the more data we have, the better off we are to find a path to where people are getting the care that they need and deserve. So just real quick, I'm not going to spend a lot of time on this. I know it's kind of small anyway, but through those facts and figures last year was the first time that we have we call it a heat map of prevalence of Alzheimer's disease. And again, I do want to reiterate that it is Alzheimer's dementia, not all dementias. And we'll kind of talk about what that looks like and what that means. But before, we never had any information of what it looks like county by county throughout the United States. We knew it was there, but we did not have the data collected. And you can see some of these counties that are, over 12% of their population is affected by Alzheimer's disease. I know this is a webinar, so no one can really answer, but on that, I was talking to a data person and she does a lot with the Traeger Institute, and I was giving a presentation to some community members and doctors, and I was like, look at Eastern Kentucky. We know it's prevalent, right? Like I used to work in another nonprofit that it was spina bifida. It was a child neural disease. And so that's where I spent a lot of my time. We know there's lack of access and care in those areas. And I will note that this is people that have been to the doctor and have been diagnosed. So you can see some of the counties that maybe unexpectedly may not be in the red, but that doesn't mean that they aren't. So again, this is reported diagnoses, which again would heighten those numbers quite a bit. And if you don't live in Kentucky, this is available for all states. You can just go to our website, alz.org. Okay, so the mission of the Alzheimer's Association is to lead the way to end Alzheimer's and all other dementias by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. When I started, I knew about the Alzheimer's Association. Uh, Everybody kind of, you know about it, but you don't know who they are. And when I started here, one thing that really stuck out to me is not only the care and support and the walks, but why do we walk? And the Alzheimer's Association is the third leading funder of Alzheimer's research in the world. And that's up against the Chinese government and the American government. We are the number one nonprofit funder of research in the world. So I always like to start out with kind of, level setting of what dementia is. I have this in every presentation I provide, whether it's for professionals, whether it's for caregivers, whether it's just for the general public. Because even though your loved one may have a diagnosis or you know someone with dementia, oftentimes we have people that come to us and is like, oh no, my loved one has Alzheimer's, not dementia. And so understanding that dementia is the umbrella term of the loss of memory that, eventually does interfere with daily life. It's kind of like heart disease. So it is an umbrella term. And under that umbrella are the diagnoses the disorders that cause that dementia. The reason we talk about Alzheimer's, when you know more about Alzheimer's, is because it is 60 to 80% of all cases. Um, you know, and also I want to note that the Alzheimer's Association, our legal name is Alzheimer's Association Related Dementias. That's a very long title. So many people ask us, do you provide support and care for the other dementias? Absolutely. We are here for anyone with cognitive impairment, memory loss. So just know that. But there are different dementias, vascular dementia, Lewy body. A lot of people have heard of the front temporal dementia here lately because of Bruce Willis. And so all these dementias, they do change the brain in different ways. So sometimes you might see trends in different ways that they communicate or repeating themselves, but there are some different behaviors that come with the different diagnosis. And this is another reason, and I'll talk a minute about why it's important to have that definitive diagnosis. So, Alzheimer's is the most common cause of dementia, like I said earlier, and it is not part of normal aging. Um, Whenever my great grandmother was living with my grandmother, she was a caregiver, but none of us really knew much about it. That was 25 years ago, maybe longer, probably 30 years ago. And you called it senile or the old timers disease, or, well, they're just getting older. That's part of life. That just isn't true. Unfortunately, this is a disease, and it is a progressive disease. The symptoms do gradually worsen over time. At the beginning, there might be in early stages, the memory loss might be mild, but in the late stages, the individual will lose the ability to carry on conversations and respond to their environment, unfortunately. On average, about once a person receives the diagnosis, lives about 4 to 8 years after the diagnosis, but can live up to 20. And I have seen it, I've heard of it. And so we always say one person with dementia is one person with dementia. And I will note too, I don't think I put this in my other slides, is this disease, most people think, oh, I'm not 65. Why do I need to know that information? Why do I need to worry about my memory? While most, obviously age is the highest risk factor, but it's called younger onset Alzheimer's, where people in their 30s and 40s can also be diagnosed with this disease. So again, not to scare you, but that is the facts of life. And thinking that this is only an older male disease just, isn't accurate anymore. And just to bring that awareness is so important. So the other day I had a staff retreat and I like trivia and I'm like, hey, who's impacted by Alzheimer's? And everybody's like, I feel like this is a trick question. Like, because I mean, we work in this space, we should know, but everyone's impacted by Alzheimer's. That we just talked about the aging population, the sandwich generation. One quarter of dementia caregivers are in the sandwich generation, and what that means is the person living with or the caregiver, excuse me, is not only caring for their young child but their aging parents, and that has a whole different, unique challenge to their caregiving. The U.S. workforce, a lot, we really, a lot of times people think that maybe we only give presentations at facilities or, for senior groups or things like that. We talk to everyone because everyone is impacted. That includes the workforce. When people are caregivers, they retire early, they come into work late. They may miss more days than, anticipated, and that but if you have that care and support, if you're on a wellness team or you're in HR, it's important to have those supports so that way they can get respite for their loved one. They can go to a support group so they don't deal with so much burnout and can really deal with their caregiver stress. So even the workforce, employers are very affected by this disease. Women, we'll talk about women here in a few minutes, but they are two-thirds of caregivers, and also one-third of caregivers are daughters. Black and Hispanics and the LGBTQ community. The LGBTQ community, a lot of people are like, well, why is that? There's women, there's Black, there's Hispanic, Asian. A lot of times this community doesn't have the support of other communities. Maybe they don't have children, maybe they don't have their parents around. And so that has, again, different unique challenges when they're reaching out, where they're aging to really get that support and those resources. So populations at high risk, Black Americans are about twice as likely as white Americans to get a diagnosis of Alzheimer's. Hispanic are 1.5 times. And so we look at that. And a lot of people ask me, well, why is that? Alzheimer's, of course, in these diverse communities are more likely to endure poverty or have limited access to quality care. They also have less likely to pursue a diagnosis, receive support, or participate in clinical trials. And we'll talk a little bit about clinical trials. But also, there are other health factors that can heighten your risk for Alzheimer's, like heart disease, diabetes, things like that. What's good for your heart is good for your head, is what we kind of say. And so some of those also are a higher diagnosis in some of these populations as well. And again, women are disproportionately impacted. There's over 11 million women that are either living with Alzheimer's or caring for someone right now with Alzheimer's. So again, and women in their 60s are about twice as likely to develop the disease over the rest of their lives than they are to get breast cancer. So when you look at what does this look like? Why is that twice as many, 1.5 times as many? And what does that support look like? I work a lot in some of our communities and really try to get some champions, and we'll talk about why that is important in your community. But why is this different in different communities? And so in the Black or Hispanic and the Asian American, their caregivers, we do surveys as part of that facts and figures. There's greater care demands, there's less use of outside help, and there's greater depression. And because of that, there's more anxiety because maybe is transportation an issue? Are they in a food desert? Are they close to a hospital? Can they get to a hospital? And it's also about the education, and breaking down some of those stigmas in the communities that it's okay to talk about it and to reach out for support. In clinical trials, I was talking earlier about this space changing so quickly. There's treatment for this disease that has never ever happened before that really works on the hallmark of the disease and not just the symptoms. But we have to get that data. We have to have clinical trials to break some of these barriers and to make sure that people have access in the treatment that all these other diseases have. Back in the day, there wasn't treatment for cancer, but now look at it. That's where we want to be when it comes to dementia and other related Alzheimer's or other related dementias. And so, I know you say clinical trials, and rightfully so. There's a lot of trust issues when it comes to clinical trials. I do understand. But, if we want to get where we need to be and treatment and diagnostic look the same across the board for every community, then we have to be in clinical trials. I mean, you see that we need more people in clinical trials, period. But when you see that the underrepresented ethnicities, Black and Hispanic, 1% in Hispanic and 5% in Black participants. So again, um, it's just incredibly important to be part of the process so you can be part of the cure. So, adult children and spouses of people living with dementia often serve as primary caregivers, as you all know. It can be challenging for all family members to accept challenges in their role and their responsibility. The demands of caregiving can limit caregivers' ability to take care of themselves. I think it's about a little less than 50% of caregivers in Kentucky have comorbidities um, when that are caregivers. There's a high percentage of caregivers that pass away before the person with dementia. And this is because they're not taking care of themselves. They're not going to the doctor's office. They're taking their loved one to the doctor's office. So again, caregiving can give you a greater risk at anxiety, depression, poor quality of care or quality of life. And this it's statistically, if you know more, and if you're more engaged and you reach out and get the support, and really understand the disease, um, that is one way to reduce your stress and your depression is because you create your own community of people that get it. And you also understand when your loved one is lashing out or maybe repeating themselves over and over and over again, and you've just had it. Well, if you have tips and strategies to be able to, really kind of navigate some of that, nuances and things that can just really drive you crazy after a while, that can really help with your mental health as well. So this is always one of the slides that get people thinking, and they're like, "Oh, wow, do I have that? Do I have that?" And again, these are just the 10 key warning signs of Alzheimer's and dementia. That doesn't mean you have to have all 10. If you have a few of them, again, that would be important to talk to your loved one or your doctor. And just a few examples, withdrawal from work or social activity. What if Miss Smith isn't showing up to church anymore? And she comes every Wednesday, Saturday, Sunday, whenever there's an event or the church is going on, she's been there. Why isn't she coming? Sometimes that might be because, big crowds are starts to make her anxious, or she can't carry on a conversation like she used to, and she's afraid people will notice differences. Again, decreased important judgment. I always give this example. So a loved one called us and she said, "My husband went to the travel agent and spent $50,000 on a trip we not only can't afford, but we're never going to be taking." Was that something that he's ever done before? Absolutely not. So you start thinking about those things that that person is just out of their norm. Um, you know, Difficulty completing familiar tasks. What if your loved one was always really great at bookkeeping, keeping your checkbook, making sure the bills were paid, and then all of a sudden the electric's getting cut off or the bank account is going into the negative, things like that. Really pay attention to and start having those conversations. So really, memory loss that disrupts your daily life, that's change in behavior. If you're going to the grocery store and you've never had a problem before, and on the way back, you're like, I think I missed that turn. Where should I go now? Things like that. If you can't retrace your steps, people come to me all the time and say, I lose my keys all the time. Like, is that a warning sign? Well, it's whenever you can't retrace your steps to find those keys or you forget what those keys go to. That's when our brains do age. Our brains don't look like they did when they were 20. And so there's going to be some times that you're going to be forgetful, but these are the things that, when it's changing and disrupts your daily life, you're not able to do the things you used to be able to do. Those are the times that you really start thinking, maybe you need to start asking some questions when you go to your doctor. So, the importance of early detection, like I said, I think this when I go to different communities, when I hear from different caregivers from different communities, some people are like, why does it matter? Why do I need to know that I have this disease? There's no cure. Um, and I had someone come, I was in a presentation not too long ago that they're like, what if my loved one doesn't want to know? We're going to come up against some of those challenges of really, there is a process in when you think that maybe you have memory issues, there's grief, there's frustration, you're angry. But now there is stuff you can do. And just not only the care and support when it comes to support groups, education programs, learning more about the disease, learning how to communicate with someone with the disease, learning about it yourself. If you have a diagnosis, we have different programs for newly diagnosed patients. You create a community, you create information that when something pops up, you know what it is instead of, well, what is that? Is that something I should worry about? Who do I call next? What box do I need to check? You have that information at your fingertips. So that is a huge part of the process. The second is you want to plan for your future. I know when I get older, I want to have the ability to say what happens to me. Right? Do I want to stay at home? Maybe that's not an option. But maybe I want to go into one of these fancy assisted livings until, I maybe go into memory care or something like that. But I want to plan for my own future and not leave that up to my loved one because that also reduces their stress. Because when the time comes, you have a plan in a plan of action. You can explore treatment options. Like I said earlier, this is something I know that I'm about to run out of time. I talk a lot. So there are treatment options. I will go through this next slide. But again, knowing is going to be something that not only can be helpful for you, but for your community, for your neighbor, for your friend. And so again, because early detection, the new treatments only are geared towards MCI, which is mild cognitive impairment due to Alzheimer's or early stage. So, those patients that are in middle stage and that, or in late stage, that's not an option for them any longer. So again, these new treatments that really target the amyloid plaque in the brain, which is the hallmark of Alzheimer's disease, gets rid of it. Is it a cure? No. Does it give you more time? Is it hope? Absolutely. And so it has been proven that it does give you longer time in that independent phase. And that's the phase where you make those memories, where you are with family, when you make a plan. And so that, again, is another reason that it's not just like, what's the matter, right? But there's also symptomatic drugs that can help with different behaviors and, the confusion and memory loss. So there are things out there, not to just say, well, I have a disease that's incurable. What So again, early detection, understanding what those 10 warning signs is just incredibly important. So now that we're talking so much about Alzheimer's and this space is growing so quickly in a hopeful way, and unfortunately in a population way as well because of the baby boomers getting older, what can I do to reduce my risk? There are things you can do today that can help your brain health, and it's never too late. And I will go to the next slide. So I'll quickly go over some of these. Challenge your mind. If you're not good at art, pick up an art project, do crossword puzzles, get moving, maintain a healthy weight, control your blood pressure, and manage your diabetes. Like I said, a healthy heart and a healthy brain, they are very, very much connected. Also, sleep. Sleep is very connected to, there's a lot of research on sleep because when you go to sleep, it kind of untangles and clears out some of those things in your brain. And so if you need a sleep apnea machine, I do encourage you to do it. My mom always said absolutely not because it sounded like a train, coming through her bedroom, but they are much improved. And so again, sleep is very, very, very important. So I know a lot of this conversation is supposed to be about community engagement, and that's exactly, our organization. We are in like a public health model. We know that if I'm going out and Meredith is the program manager is going out to communities that we don't live in, that don't reflect the population, how far are we going to get when it comes to breaking those stigmas down, making sure people understand this disease so they can reach out for care and support. And so we do rely heavily. We are a volunteer-led organization. Like I said earlier, I worked a lot in Eastern Kentucky, and if you can't hear my twang, I fit in a little bit, right? But when I would go to Pikeville, they knew I wasn't from there. I would always have to send the mail out in Berea and not in Louisville or Lexington because people look at that. We want people where they're at, where they eat, sleep, and pray to be those champions in that community to ensure that people are getting this information. And so just a little bit about what we do. We have a 24/7 helpline. This is for anything. If you just need somebody to talk to at 2 o'clock in the morning because you have had it, you're at your what's in, you just need somebody to talk to, you can call this number. If you want to know what are the new treatments and would I be eligible, what does it even look like, you can call this number. Somebody asked me, is it only for emergencies? Absolutely not. It is also not contracted out to a third party. It is our organization and is housed by master level clinicians. You can also find support groups by zip code. So if you don't live in Kentucky, this number is still for you. And that is something I will talk about too. All of our education and support groups, this is a Alzheimer's Association model. So it is from coast to coast. So if the 10 warning sign slide you just saw, yes, I have it here in Kentucky, but it's also in California. It's in Washington, D.C. So our messaging is very uniformed throughout the United States. And then we also have free education and programs. Our organization, we have 125 counties. You heard about our helpline. I do suggest if you ever need any help, have any questions, please call that if you look for an online education program. But throughout the United States, here in Kentucky, we have over 27 support groups. We have education programs, anything from 10 warning signs to empowered caregivers, really making sure our caregivers understand what is caregiver stress, because I promise you're probably going through it, but how do you manage that? How does the person living with the disease, how do you manage their independence? We want to make sure we treat people with dignity and respect, and what does that look like? Early stage programs, physician outreach, and then also our caregiver center. Anything that we have in person, we also have online. We know caregiving needs aren't 9 to 5, and a lot of our programs sometimes are in the afternoon if you're working, or if just, I know my grandma used to have bad days, and if she was having a bad day, we were not doing anything that was planned. But I'm sure these slides will be given out to you all after this program. I know this one's very busy. I've kind of talked about most of them. One I will talk about just for 2 seconds is our community resource finder. So if you're, say that you're seeing someone, your loved one, my mom's snowbirds in Florida. So, oftentimes if there's something going on, or if there is something that does happen, I can look up resources for her in Florida through our community resource finder, because everything is by zip code. So it's a comprehensive database of different resources, where that's respite care, where it's a diagnostic center, if it's an education program. So again, this is really great. Even if you're living in Louisville, I used to live in Louisville, and it would take me an hour to get across town. That's not where I want to go to a support group or get an education program. So again, that's the one last thing I'll say about the resources. We have a lot of programs. Always check out our website. Our new program coming up is at A New Era in Memory Care. So if you want to know more about these treatments that have just came out, another really groundbreaking thing that came out of our AAIC is the diagnosis of dementia through blood tests. Right now, to get a definitive diagnosis, it is quite a process. And so drug tests are on the horizon. Some physicians are already doing it, but it is going to be FDA approved. It's up for FDA approval. And so this will change the landscape of what it looks like to get a diagnosis, and really make it easier to access care, and also it's less invasive. So finally, just some more programs, but I really just want to spend the last few minutes on what you can do as community members. I hear a lot of people say, and at the very beginning of this program, you guys are doing amazing work. And as professionals in this space, how can you reach more people? How can you help? And when it comes to dementia and Alzheimer's and spreading that word, as an individual, of course, if telling your personal story, becoming an advocate, becoming a champion if you have been anyway affected, people relate to that, because you're breaking down that stigma that, oh no, mum's the word. Like my grandma used to say, mum's the word. So we don't want that anymore, right? We want people to talk about it, just like you would talk about having high blood pressure. Making sure that it's part of a conversation, it's a discussion. Help your neighbors. If you see them struggling, invite them to a support group, or give them our information. Be part of a clinical trial. I always talk about our walk, because that's really kind of how I got started in the Alzheimer's Association, because I wanted a way to celebrate my grandmother. This disease isn't always sunshine and rainbows. But I wanted a way for all of us family to get together, remember who she is, who she was, and raise funds for an amazing organization. We made T-shirts. And so again, I always talk about our walk and it's also one of our largest support groups in the nation, because there's resources at your fingertips. And then lastly, I want to make sure there's Q&A. I'm way over time, so sorry. If it wasn't a webinar, you guys could scream at me and tell me to stop. But anyway, like I talked about earlier, we need our champions in our communities. We have these awareness presentations. It's pretty much what I'm showing today, minus a few other slides. It's really just a full mission program that tells people need to know what the urgency is of this disease. I talk to people. I've not met one person that isn't affected, but a lot of people just don't know where to turn, or don't know that it should be a conversation. And so we need champions in our communities. We need people that are going to get out there and talk about it, that are going to host Purple Sundays at their church, that are going to set up programs at a women's luncheon, or at a Rotary Club, or at a library, just to talk about this disease. to make sure that we're getting the word out there. When we were the volunteer model, we were only reaching less than 2% of the population that needed our information. We are now reaching more people than ever before, and that's because of champions, people in our community that want to take that step, that really want to give back to their community in a way that's going to serve them as community leaders, but also serve their community and give them the help and support that they deserve. So if you're ever interested in, this is only one, we have many, many opportunities at the Alzheimer's Association to really get involved and, fight for our mission of a world without Alzheimer's or related dementias. So if you're ever interested, always go to our volunteer.alz.org champions. It's about an hour of training. And so it's just a really great way. You get your elevator speech together. I give you a presentation. We work together. And you would be surprised how many people are going to invite you into their doors to really talk about this information. Okay, and the rest is just about walk and clinical trials. And so this will be sent out to you. But again, I just want to be courteous of time. And that way, if there's any information or any questions, and that way we can have more of a discussion too.
Thank you, Erin. I appreciate it. Lots of great information you shared. And I hope you can hang out with us for the next 9 minutes or so to answer any questions that the audience may have. They did share some questions pre-meeting. I want to get to those, and then hopefully we'll have time if anyone wants to pop a question in the chat. Nick will field those questions for us. Also, before we jump into that, I'd love for you all to scan this QR code on your iPhone or your cell phone so that we can get your feedback on these meetings. Again, as I mentioned earlier, your feedback is really how we shape these meetings and how we identify speakers to talk to us, but also more importantly, better understand what type of information you need in this space. So please scan the code and share your feedback with us. So with that, we have 8 minutes. So I want to try to get to your questions. I know that Cheryl Tier, she is one of our community advisory board members, and she popped a question into the Q&A section of the webinar regarding testing specific to blood tests for Alzheimer's. And then Erin sort of answered it to a certain degree that this is showing up at the FDA, and it's just a matter of time before we have approval of that, which I think from a cost standpoint is going to really be important for us. But then I think also from an access to care and treatment and early diagnosis is going to be a game changer. So is there any additional information I put information in the chat to respond, but it was just a quick Google. Erin, do you have any additional information on the blood test to identify whether or not to diagnose Alzheimer's?
You can go to our website, or you can look up AAIC, which is the Alzheimer's Association International Conference. And so that was just released. I have a press release that I can send you all too, if you want to send that out with the resource information that kind of gives a little more information about it. But this was just released in July. The information about how they've been working on it for, years and years and years. But the information that they are seeing those biomarkers within a blood test that should soon be utilized or could be utilized by many, many doctors. And not to say that all doctors will do it. We don't know that. Some people may not want the blood test. I know at CHI, Dr. Odago, he's the one that was in that flyer. He uses it at times. And so we do see that it's going to be more prevalent the more we're talking about it and the more it gets out. So I will definitely send you some, Q&A or facts about it.
Okay.
Yeah.
Thanks, Erin. And if you could send that to us, we'll share it with everyone when we share materials out. Okay, so the first question I have is how can I connect additional community orgs with this project? That's easy. I think that Nick shared her email address in the chat box. Feel free if you want, Nick, you can include my address and Catherine's address. But just connect with Links to Equity. We are more than happy to reach out and support other community orgs, give them information about the project, but I think more importantly, to allow them to share the great work that they're doing as well, and just be a good collaborative partner with them. That's really our goal. As I mentioned, through this webinar series, we've met so many additional community organizational partners. That's just really changed how we're engaging at a community level. So just reach out to us and we will absolutely be back in contact with you and engage you in the work that we're doing, but also share the great work that your organization may be doing, as well as identify opportunities for partnerships. Here's a question for you, Erin. What are the warning signs, if any, which you went through your 10 warning signs?
Yeah, and I can share that too. So just a few. I could, well, it's any memory issues that are going to change your daily life. Like if you can't remember to do it any longer. If you have a hard time with space or time, if you're forgetting what year it is or who the president is, or maybe it's Monday and you're thinking it's Wednesday or Thursday. Don't get me wrong, if you're crazy busy all the time, you can get your days mixed up, but it's more like the years and the president. If you're making poor decisions, if you're losing things that you can't retrace your steps. And again, you don't have to have all these to talk to your doctor. And I do want to make sure that is an important fact, that don't wait until you got 10 out of 10 to make sure you're starting to have these conversations. If you're having a few and if it's impacting your daily living in a way that, obviously that has changed, that's when you need to start having those conversations.
Thanks, Erin. Here's one more that I think that you touched on, and we'll just double click on that answer. The question is, can one slow the process? And you talked about the new treatments, and I know that the new treatments, that's exactly what they do, is slow the process. But I want
Absolutely.
you to
Well, and also social engagement. If you, I guess the question was probably if you have if you've already been diagnosed, and can you slow the process? It is still important for social engagement. This disease can be very, very isolating. And so, when you're isolated and you're not getting that stimulation when you're talking to somebody or being around people, it is truly important to still have some type of social engagement. We have memory cafes here in Kentucky. There are opportunities for social engagement. Also, your diet. Even if you're newly diagnosed and your symptoms might be very, very mild now, like I was talking about, it's never too late to start exercising. One of our families that she has younger onset, she's in her 40s, and she started learning Spanish. She's starting to play piano. Those things aren't lost. You can still do those things, and it is still good for your brain.
that's excellent.
Exercise.
Yeah.
Gardening. My grandmother loved to garden. She loved to pick off the blooms. We still did that because it was, just because they have the disease doesn't mean they still don't need stimulation.
Okay. And the final question, what support exists for those supporting family members long distance? And I'll just share that I think that it's a good idea to look to the city and state in which your family member or loved one may live and sort of identify what community programs exist there, and do that through various community organizations. But also I know Alzheimer's has a great list within each state of the various resources available. But Erin, I'll hand that over to you for more detail.
Yeah, absolutely. So our community resource finder, you can definitely find some of those supports when you're talking about in-home care, doctor visits, doctors to go see. So I do really suggest doing that alz.org/CRF. But also making sure you're knowledgeable about the disease and who are their care partners around. Maybe you're their daughter, but do they have neighbors? Do they have friends that can go in and check on them? Are you talking with them about this disease? Also, every state has an area on aging. And they provide a lot of support. Sometimes that can be financial support for respite. So here in Kentucky, we call it the Area on Aging. In Indiana, it's SWRCA. So again, they may have different names, but it is typically Area on Aging. So typically, you can just look up Georgia Area on Aging, and those typically are housed under the state government. So they have wonderful resources. And then again, also reaching out to your local Alzheimer's chapter because we work a lot with a lot of community partners, just like Links to Equity. And so all chapters do across the nation. You know, that's how we get our word out. That's how we help the most people is working with our community partners that are vested in our community so they can also point you in the right direction wherever you live.
Okay, I hate that we ran out of time. There's two really good questions that I missed in the Q&A chat. So what I'm going to do is I'm going to send those over to you. One is about insurance companies covering the treatments and the tests, and I think that's I can tell you that that's going to be based upon your insurance. I think that the safe answer is yes, there are, but it depends upon the plan that you have, which will dictate coverage. So that's the answer for that one. And then we talked about the two types of proteins, the beta amyloid and the tau proteins, and then testing for those. I'm not quite sure if that blood test, I would think more the PET scan would address those, but I want to get really clear and specific answers to that. Do you know the answer to that, Erin?
I know that I have, you know, if you're thinking about getting the treatment, some of those processes will still be like you will still for CMS approval and insurance wise, you know, once you have a diagnosis, you know, when it comes to which kind of Alzheimer's disease and things like that, if you're to make sure you're eligible for this treatment, some of those processes will still have, like the PET scans or, you know, uh, the spinal taps and things like that. So it's not going to be as broad and specific. It's more broad than more specific. But yes, I don't know 100% all the details, but I can definitely get you guys that.
And I'm going to do the same. There's still a few more, and I hate that we didn't get to them. But I will follow up with you. Nick will follow up with you. We'll get you the right person to connect you with so that you have the most accurate information. I know we're 2 minutes past time, and I really want to be respectful of everyone's time this evening. I'd like to just thank you all for being a part of this discussion this evening. Your participation, your engagement is really important to us. We hope that you continue to join us in this journey. As I mentioned a little earlier, our next speaker is going to be Dr. Erin Epps. She is the founder and a nurse and PhD for Alter. Alter is a program that engages churches to support on this Alzheimer's journey. And a part of what Alter does is they actually prepare churches so that they can support their members living with Alzheimer's to be a part of the congregation and continue to be in that church. So they're doing amazing work, and we're very honored that Dr. Epps will be with us in January for our next webinar series. So we will absolutely get that information out to everyone on this call. And without further ado, I just want to express my gratitude to all of you for being here, and especially to our community advisors who really is the reason why we were able to do and have such a broad reach in this space. So everyone have a wonderful evening. Any questions, please feel free to reach out to us. We're here for you, to support you, and to answer any questions. Thank you so much for being with us this evening.
And thank you again, everyone.
Thank you.
Have a good evening.
Good
Thank you
evening.
so much. Thank you.
Good
Great
night.
presentation, Erin. Very, very good.
Thank you.
You're
Hey,
welcome.
thank you. Thank you.
Good night.
Good night, everyone.